Welcome and thank you for tuning in. You're listening to the Beyond 50 radio program. I'm Daniel Davis. Today, healthy living is something that's on everyone's agenda, and trying to achieve that in the best possible way is always a maximum goal we all try to achieve. On the program today, we'll be talking about someone who practices internal and integrative medicine to treat patients and the benefits of combining both types of medicine to be able to help people achieve this through a mindful-based stress reduction program, dietary and exercise recommendations. We're going to find out what makes this such a unique way when we approach the fact that we bring these two things together and offers advantages to patients who come to visit this particular physician who is very well qualified when it comes to doing this. After all, when you want to achieve maximum health, think about someone who, for instance, finds ways that he has time to be able to be an Ironman triathlete, who's qualified the half Ironman World Championships and has competed in several marathons and an ultramarathon as well. So when you go to visit this particular doctor, you can be sure that you're going to be healthy. Joining us here on the Beyond 50 radio program today is one very special person by the name of Dr. Enrique Gomez-Mariana of the Healthy Living Internal Medicine Clinic, which is located in Portland, Oregon. I'd like to welcome to the Beyond 50 radio program today our guest, Dr. Enrique Gomez-Mariana. Dr. Mariana, thank you for joining us here on the Beyond 50 radio program.
Yeah, thank you for your introduction, Daniel, and thank you so much for having me today.
Well, you're somebody who's very committed to the well-being and the health of people that come and see you. Tell us how this all started for you.
All right, I'm going to start by telling you a little bit about myself. And as you were saying, I'm a board-certified internal medicine physician. And I do have a background in emergency medicine. I worked as an ER physician for 4 years. After that, I did my residency in internal medicine. And I practiced hospital and outpatient medicine for 3 years. While I was doing this, I noticed that a lot of patients, the patients that I was seeing, were suffering and being admitted to the hospital on several occasions from diseases and disease complications that could have been prevented. So I noticed that it was a vicious cycle, since they will come into the hospital over and over for the same medical problems. And I noticed that the roots of their medical problems were never addressed in the outpatient setting. So I have always been a firm believer in preventive medicine and integrative holistic medicine. And these experiences that I have during my career really switched my focus and to concentrate more strongly and incorporate integrative medicine into my practice. As you were saying, outside my profession, I have always been involved in sports, participated in long-distance triathlon and long-distance running, and I just have a love for nature, animals, and just the outdoors in general. I also love traveling and learning from different places and cultures and how to live better. And I have been practicing Vipassana meditation on almost a daily basis for the last 14 years. And I'm always, of course, trying to update myself and grow at the spiritual, mental, and emotional level. So in a nutshell, I try to practice to the best of my ability and incorporate all these things into my personal life, and then in order to be able to teach this to my patients.
Well, that's a very big nutshell.
Yeah, that's right.
Now, tell us what internal and integrative medicine actually means.
Okay. As an internal medicine doctor, you usually see patients at 12 years of age or older, and our approach is very broad. They call us the gatekeepers because usually the patient has contact with an internal medicine doctor for the first time in healthcare. We see most medical problems. We usually initiate assessments, diagnosis workup, and in a lot of cases, treatment. If we find something that requires a patient to see a specialist, we usually guide them and refer them to the appropriate specialist. In terms of integrative medicine, you see the patient as a whole. You take into consideration multiple aspects that revolve around mind, body, and spirit. Strong emphasis is made on preventive medicine, including following a healthy diet and exercise program, and you also take into consideration psychological, emotional, and spiritual the spiritual well-being of the individual. Other aspects that we take into consideration are stress reduction, relaxation techniques, recreation, and we look at other aspects in the life of an individual like profession, purpose in life, and involvement in the community. We also reach out to alternative medicine techniques like acupuncture, chiropractors, naturopathic medicine, and in a lot of cases, nature and animal-assisted therapy. There are so many benefits that you can get by spending time with animals and nature. All these things have been well studied, and there's good documentation of how people can benefit from these things and how helpful they can be in someone with major medical problems that currently affect our society, like depression, anxiety, chronic pain, and many psychosomatic disorders. I personally believe that there is so much power and truth in integrative medicine, and that it's a resource that the medical community underutilizes.
Now, it's amazing when you think about somebody, when you go to visit them, who actually sits there and takes time really getting to know somebody. How are you doing? Are you happy? Things like that. And that's somewhat kind of uncommon for people when they go to see a doctor.
Yeah, that's right, especially nowadays in our current medical system. It looks like doctors and patients, or especially doctors and healthcare professionals, are always rushed and that sort of time. Absolutely.
Mm-hmm. So tell us about the experience for people who come to see you.
By combining traditional and integrative medicine, overall you get a broader and deeper evaluation by looking at different aspects in the life of an individual. And you have more tools to use in order to prevent disease and promote wellness. You have resources that can be very powerful, like spirituality, exercise, diet. They all promote a strong and solid foundation for a healthy individual. So before I start to label a patient with different disease and prescribing pills to mask or treat some of the symptoms, I try to go back to the basics of preventive medicine and also look for underlying causes of the disease. It's a great thing to be able to combine these two together, integrative and medicine and traditional medicine. With my patients, I usually start by concentrating on integrative and preventive medicine, tailoring a very specific plan for each patient. This plan usually includes healthy living habits, healthy eating habits, an exercise program, and usually stress reduction, which is very prevalent on our society nowadays. Mm-hmm. As I mentioned previously, there are multiple aspects in the life of a person that can be tweaked or worked on in order to increment their well-being. By doing this, you can prevent a big percentage of medical conditions and problems. Examples of these are obesity, high blood pressure, hyperlipidemia, diabetes, heart disease, anxiety, depression, even certain types of cancer. And all these medical problems can severely impact the life of an individual in a negative way. So, and in big part, these all are preventable. So, other aspects of important aspects of preventive medicine is using screening methods that currently exist for particular medical problems. And in terms of traditional medicine, it has a very important role, and sometimes when in spite of the physician and the patient doing their best effort as a team to come up with a plan, and prevent these conditions, disease still presents or is uncontrolled due to the severity of the illness or genetics or environmental factors. And at this point is when traditional medicine offers other extremely helpful options and solutions like using medications, non-interventional and interventional procedures, or if the patient needs to be hospitalized, or if you need to use more aggressive therapy. And I just wanted to mention lastly that by having worked as an ER physician, I know that there are times when traditional medicine is imperative and extremely helpful, and some of these cases are where emergency procedures will be life-saving, or in accidents or conditions where the only measure left is a surgical intervention. So traditional medicine also has its place, of course.
Well, it sounds to me that somebody coming to visit with you is certainly going to be in very articulately good hands.
I hope so.
Yes.
That's
now, tell
goal.
us, mindful-based stress reduction. That's an interesting term that you typically don't hear when it comes to a doctor. What's that all about?
Well, this is a technique that was born at the University of Massachusetts Medical School. It was created by a person named John Kabat-Zinn, and it's based on ancient Vipassana meditation techniques. These techniques were born 2,000 years BC, and basically the technique consists on fine-tuning our concentration by placing it on different objects. The most common one is the breath. And we use this because it's always present and it's always with us. So by concentrating on inhaling and exhaling, just by the sensation, it's a very fine sensation that we can perceive in our nostrils. By doing that, we calm the mind and we become more aware of our thoughts, our emotions, feelings, of our body in general. This method has been very well studied in depth in the lab with functional MRIs, and there's several reliable studies published in medical journals that have shown that this method has markedly improved conditions like chronic pain, cancer pain, headaches, migraines, allergies, decreases blood pressure. It helps in some cardiac arrhythmias, anxiety, depression, panic attacks, post-traumatic stress disorder, these among others. So it has been well studied, and now it's actually has been introduced in several medical schools and residency programs. And they incorporate this method first for the healthcare professionals to be in just a better shape, and then once they know how to practice this, they can implement and practice this with their patients. So that's mindful-based stress reduction.
Mm-hmm. Well, it's really fascinating to hear what you're describing here, because it certainly sounds like as a person comes to visit with you that the first goal isn't so much the symptoms, although they are very important, but for you it sounds like it's more of getting to the root of what causes the stress in the first place that creates the symptoms that they're coming to see you about.
Absolutely, yeah, absolutely, and these are techniques that basically they don't cost you anything. They don't have any side effects, and you can practice it anywhere. You don't need any specific or special equipment. And as I was saying, your breath is always present with you, so it's something that you can do at any time.
Mm-hmm. I remember some years ago there was a friend of my parents actually, and he kept coming over to the house because he was pretty much suffering from a breakup of his marriage.
Yeah.
And watching him handle this particular life-changing situation, it's pretty devastating when a marriage breaks up, especially if you really don't want something like that. And it was inevitable that just not more than a year later, that he had cancer.
Yeah.
And I was trying to describe to my parents, I said, I really believe this happened as a result of the breakup of his marriage. And of course they argued, being traditionalists themselves. And I said, but can you see any other cause here? And after a while, they kind of absorbed it and thought to themselves, perhaps you're right. I said, well, look, this was pretty devastating, and the way he went about handling this certainly led him in that direction. I wouldn't say it caused his cancer, but it certainly was a pretty good alibi. And you can see how being able to have techniques in place, to help relieve stress, however that stress comes to you, is a good way to keep yourself from finding yourself in a situation such as that.
Absolutely, Daniel. I agree with you, and I think just the power that our thoughts, our mind, our emotional state of mind, and just our state of mind in general, the impact that has on our system, it's huge, and I think we're finally looking a little bit into it at a deeper level and studying this and seeing how this impacts our life and our health. And there's a lot of things that we don't know or haven't found out in medicine, but I think there's a big truth in what you were saying. Absolutely.
Now, I understand that you stepped out of corporate medicine. What exactly is that, and why did you do that?
Corporate medicine, I'm talking here about the big groups around the nation. Mm-hmm. And I have worked in the U.S. health system for going on 4 years, and I looked at many options to practice medicine, including small, medium, large-size practices, private groups, hospitals, government positions, community health centers, and I found myself and my patients in a very complex medical system. I noticed that our system our medical system was negatively affected, or if I want to use the word contaminated, but I guess I could, and by a lot of situations and around the patient-physician relationship, and this includes administration, management, pharmaceutical companies, policies, lawyers, and other non-medical people that are usually around the physician-patient relationship. So I found myself always rushed, always short of time, spending large amounts of time performing tasks that are absolutely irrelevant for patient care, and that will not really benefit or impact the patient in any positive way. I want to say that most healthcare providers are overworked, in a lot of times being ineffective, and I found myself deeply dissatisfied with this. All this pressure from different angles, from all these different angles, I think they always seem to devalue the physician-patient relationship, which is so important. So I came to a point where ethically and morally, I just couldn't keep doing this anymore to myself and to my patients. I was not getting the tools and support that I needed to provide good medical care, and the patients were not getting the time and the quality of care that they always deserve. So that's what made me branch out of corporate medicine.
Mm-hmm. I know the big thing, too, that's always, especially when it comes to a new political running for office, is to talk about revamping the healthcare system. And one of the big topics, of course, is insurance, which people tend to look at as a form of security and assurance. I feel protected if I have health insurance, for instance. But then again, anybody who's actually had to deal with that finds themselves with sometimes limitations that leave them scratching their heads. Well, I paid my monthly premium. What do you mean you're denying me access to be able to do this particular thing? So you find out that you have a lot of insecurity and chaos going along. How have you found yourself being able to work around the turmoil that happens when it comes to health insurance?
Well, specifically in terms of health insurance, as you were saying, it's pretty complex, and we're a little bit with our hands tied because they basically dictate what you can do, what you can't do, what they will pay for, why they will not. So trying to incorporate, for me, the most important thing is to create a meaningful patient-physician relationship and to make a lot of emphasis on preventive medicine, on preventing disease. Once the disease is established, I try to incorporate the integrative medicine part of my practice and really try to use as many resources as I can that will not block the well-being of an individual. A lot of times you have to provide really good documentation and just talk to the insurance companies if a test is needed or a treatment is needed and for a specific patient, and they usually tend to be reasonable, but if you look at that on a regular day and you have to spend extra time and work doing this with each patient and each insurance company, it just generates a lot of extra work and stress for the patient, stress for the provider, and it's very time consuming. So definitely I try to work around it, but I think there has to be major changes in the insurance companies' policies in the next few years for things to improve a little bit for the patient and for the physicians.
Well, there's no doubt that what we need to see especially is more transparency, and I know that in the state of Florida, from my understanding, is they're beginning to experiment, for lack of a better word, a way that they pretty much like when you go to a restaurant, you see how much a meal costs. They're doing the very same thing when it comes to healthcare there, and so it's creating a different kind of a system that's actually beginning to be very successful because I think the biggest fear people have and why insurance makes them feel comfortable, even though those payments are pretty big each month, is the fact that there's a sense that they have transparency. In other words, there's a way they understand or know what the costs will be. And that's what prevents people from, say, going to a dentist or a doctor in the first place is there's really no known when it comes to what is this going to cost me to go and see a healthcare professional, for instance. How do you work with something like that?
Well, absolutely. I think there's a lot of truth in that, and we usually try to be as transparent as possible, and in a lot of cases we try to call the insurance company and look at deductibles and what will be covered by them and what will not be covered, and then try to sit down with the patient and formulate a plan of what can actually be done, and if he's will and unable to cover the cost of different tests or procedures or medications that will be required for his medical treatment. So we usually try to sit down and take a pretty close look and come up with a plan to work with their insurance companies.
I think what's fascinating if people go to visit your website is they'll realize just how committed you truly are to healthcare, to being sure that individuals actually achieve their optimum health and that you're really looking out for their well-being, and that you certainly have set up a clinic that has an interesting or very unique approach compared to what's out there. Tell us about that a little bit if you could.
Sure. Well, we follow a model that it's different from the average medical clinic, and it's called ideal medical practice. This is a relatively new model that is gaining momentum in the United States. Right now, there's over 500 clinics around the country in different states, and some of the traits are that they usually have a very limited number of staff. In most cases, it's just the physician and perhaps another person. In my case, it's my wife, Lauren, which is a registered nurse, and I. Lauren has some experience in the coronary care unit, home health, wound care, and she's currently working at a skilled nursing facility here in Portland. And she also works with patients providing education, follow-up appointments. She wears multiple hats. She's the receptionist, the scheduler, the biller, the coder. So by being only the two of us and having a small office, we're able to keep our overhead very low. Mm-hmm. And this allows us to see fewer patients a day and to spend much more time with each patient. I think this is key, and it's absolutely necessary to address all their medical needs. Unlike regular practices where they have to see an average of 30 patients a day or even more, wow. With appointments, and I was there a couple of years ago, and the appointments are usually 10 or 15 minutes, sometimes less. And during this 15-minute period, you're expected to interview the patient, examine him, come up with diagnosis, address multiple medical issues, answer the patient and the family the questions that the family will have, educate the patient, do a little bit of preventive medicine, order blood work, or studies that are needed, make referrals, coordinate care, and with other healthcare professionals, and then you have to document all this in your notes. So it's basically impossible to provide the quality of medical care that someone deserves in this short amount of time, and it's very challenging for this patient-physician relationship to be satisfying and meaningful. So this is part due to the large overhead that most practices have, and the overhead is really high, and they have to just generate certain amount of money in order to pay rent for big spaces, payroll for multiple employees, including receptionists, schedulers, coders, medical assistant, nurses. And so at the end, it's all about productivity and numbers. So since we have a smaller panel of patients, access to appointment is easier. We don't have any wait time. Patients can usually be seen the same day or the next day if they call after hours. When they get to the office, there is no wait time. We see them right away. There are less communication barriers because there's only the two of us, Lauren and I, so they will be either dealing with or talking to her or I or myself. And I'm always on call for my patients. It's not like someone else is going to pick up the phone, and I expect, of course, to know their cases really well and to know them by exactly who they are and by name. And our appointments, as I was saying, are much longer, usually an hour or more for new patients and 30 minutes or more for established patients. So during this time, we make sure to address all their needs, to get to the root of their medical problems, to formulate a specific plan and build meaningful physician-patient relationship without this time pressure. So I think there's just no way around it. You need time to do all these things that you have to do during a medical appointment. I don't think there is technology or any other type of services can take place to compensate for this lack of time. You just need the time.
Now, it's a question that just has my curiosity here, but I figured that perhaps after 5 visits that you require your patients to participate in marathons?
No, not at all. Yeah, no,
After 10, you've got to become an Ironman, or don't come see me again because you're not taking my suggestions seriously.
Right. No, not at all. We formulate a very specific plan for each one of them. Yeah.
But I take it, though, that people who come to see you really enjoy and feel very confident as well as very secure in their visit, don't they?
That's my goal, and that's what I hope, and that's what I hear from them. And as I was saying, I mean, it's very different when a physician is telling you, oh, you have to eat this way and do this amount of exercise, but the physician is overweight, or if he's talking to you about stress reduction, but he's rushed and overworked and all stressed out. So I really try to walk the talk and be an example and an inspiration for my patients. And it's a little bit easier when you implement all these things in your life to guide someone and know exactly what difficulties or not exactly, but some of the difficulties that they can encounter along the way. So I think that helps them. Yeah.
Now, if you can, for our listeners, tell us where your website is, what they can find out. And I know that you practice in Portland, Oregon, but certainly they can find out certain things by visiting your website. Sure.
Our website is www.healthylivingim, as in internal medicine.org, and they can find a lot of information there, and there's a section under patient information where they can make an online appointment. They just have to click where it says make an online appointment. They can give us a call as well, and we can get them in right away. As I was saying, usually the same day or the next day. And they can call us at 971-285-0065. Again, it's 971-285-0065. And the website again is www.healthylivingim, as an internal medicine.org.
Well, Dr. Moreta, thank you so much for joining us here on the program. It's good to hear that, medicine and medical practice is beginning to turn to be more patient-based, where, you're taking the time, as necessary to be able to work with people like this.
Yeah, well, we feel that we have something meaningful and positive to give to our patients and our community, and we really want to care for them deeply and to provide excellent medical care, and we would love to become their partner in wellness. So thank you so much for the opportunity to speak with you, Daniel, and thank you so much for having me.
Well, thank you again for joining us on the program. And again, he won't require you to run a marathon, although it couldn't be a bad idea if you really want optimum health to find out just how healthy you are.
Okay.
Thanks again for being on the program today.
Thank you, Daniel.
We want to thank you, the listeners out there, for tuning in. Find out more. You can also visit us at beyond50radio.com. That is the number 50. Be sure to become a Beyond 50 newsletter subscriber. Absolutely free. You can sign up there on our website as well. I'm Daniel Davis. Thank you for tuning in. This is the Beyond 50 radio program. And remember, live your day past halfway.